Good afternoon, Miss Rana. I am Gloria Magbara from BSN1 and I will be performing a Neurologic Musculoskeletal Peripheral Vascular Assessment. First, I will introduce myself to the patient. Good afternoon, sir. I am Gloria Magbara, your nurse for today's assessment. Next, I will identify the patient by asking his name, age, birth date, and address. Good afternoon, sir. May I know your full name po?
Ace Mark Heraldo.
Okay, sir. Age,
20.
birthday,
March 25, 2002.
okay, address.
Fernandez.
Okay, sir. Next, I will discuss the purpose and procedure for a neurologic musculoskeletal peripheral vascular assessment and ask if there is any clarification to the patient. Okay, sir. I will explain to you what will be the purpose for today's assessment. Sir, I will assist you for your neurologic, musculoskeletal, peripheral vascular system. Sir, I will assist your mental health status. Does your cranial nerve palpate? I will palpate some of your muscular system and other. Is that okay, sir? Next, I will instruct the patient to void if the doctor's order. Since the physician did not order to collect a urine specimen, and I will not instruct the patient to void. Next, I will provide privacy by closing the doors and curtains for the patient. After providing privacy to the patient, I will perform hand hygiene. Help the patient to undress and provide the patient's gown. Since the patient will not dress the patient gown, I will conduct for the next assessment. Next, begin with the overall hygiene of the patients with the physical appearance. Okay. Can you do this, sir? Okay. Next, I will assess the patient's mental health status. I will evaluate the patient's orientation to person, place, and time. Sir, are you aware where are you today?
Yes.
Where, sir?
We are at the hospital.
Okay. Who am I?
Your nurse Glory.
Okay. And you?
I'm Ace Mark.
The patient.
Yes.
Okay. The time for today, sir?
It's 3:52.
Okay. Very good, sir. Next, I will evaluate the level of consciousness of the patient. Okay, sir? Please open your eyes. Close. Open. Okay. I will assess your verbal consciousness. Okay, can you repeat when I say pretty? Apple.
Apple.
Okay. Can you do this, sir? Close. Open. And raise your hand. And down. Okay. After that, I will assess the memory of the patient. Okay, sir? What did you do yesterday?
I went to mall and buy some fruits to eat.
Okay. How about this morning after your breakfast?
After my breakfast, I did some household chores.
Okay, very good, sir. Assist the abstract reasoning of the patient by asking him to explain a proverb. Okay, sir, can you explain an early bird catches the worm?
For me, we need to be early to be productive and to do more work to be responsible because time is gold.
Okay, very good, sir. Evaluate the ability of the patient to understand the spoken and written word. Okay, sir, can you read this aloud?
I woke up every morning full of blessings.
Okay, sir, can you, did you understand it? What is the meaning of this?
It is like you're waking up every morning with blessings are coming your way.
Okay. For the next section, I will test the cranial nerve function of the patient. First, I will let the patient close his eyes, then exclude one nostril, and I will let him smell a substance like coffee, alcohol, perfume, and other. Okay, sir. I will let you close your eyes, then exclude one nostril, then I will let you smell some substance like chocolate or something. Sir, can you tell me like example? I will let you smell chocolate and you will tell me it is a chocolate. Okay, can you close your eyes, sir? Then exclude one nostril. Okay. What is it, sir?
Perfume.
Okay, perfume. Very good.
Coffee.
Okay, very good. And lastly,
Alcohol.
okay, very good, alcohol. We'll repeat the session to the other nostril. Okay, can you close your eyes, then the opposite nostril, please exclude it. Okay?
Alcohol.
Okay, very good, sir. How about this?
Perfume.
Perfume, okay. Very good. What is it, sir?
Coffee.
Okay, very good. I will test the visual acuity of the patient and his pupillary constriction. Okay, sir. I will let you read some lines to know your visual acuity. Is that okay, sir?
Yes.
Okay. Okay, sir. Can you read it for me? Third line.
C. Z.
Okay, very good. The second to the last line.
E. D. F. C. Z. P.
Okay, very good. How about the first line?
E.
Okay, very good. I let the patient move his eye to a cardinal position gaze, like this and that. Okay. Can you look at me? Okay. Sir, I will let you please follow this ball pen as I move it. Okay, sir? Okay, very good, sir.
Take.
Let the patient smile, frown, wrinkle his forehead, and then puff out his cheek. Okay, sir, can you smile for me? Frown. Okay. Wrinkle your forehead. Puff out your cheekbone. Okay, very good, sir. Test the hearing of the patient. Okay.
Apple. Paper.
Okay, very good. For the next step, I will test the gag reflex by touching his posterior pharynx by a tongue depressor, and I will tell him that it might be uncomfortable to him. First, I will sanitize my hands. Okay, sir, I will test your posterior pharynx and by using a tongue depressor. It might be uncomfortable for you. Is that okay, sir? Okay, please open your mouth. Please out your tongue. Let it out, sir. Okay, very good. I will place my hand to the patient's shoulder and then I will let him shrug against it and to know that he is resistance. And after that, I will let my hand put to his right and left cheek to allow him to push it against it. Okay? Sir, I will touch your shoulder, sir, huh? Okay. Can you shrug, sir? Again, sir? For your right cheek, sir. Okay. Can you push against it? Okay, very good, sir. Next, I will inspect the patient's ability to move his neck. Sir, I will test your ability of your neck, sir. Okay, sir. Please touch your chin on your chest. Then move into the right side of your shoulder. Okay, the left side, sir. And let your ear move into your right shoulder. Again, for the left. Okay, and okay, sir, can you move your tip of your head into the as far as you can, sir? Okay, very good, sir. Next, I will inspect the upper extremities of the patient. Sir, I will inspect your upper extremities if there is a lesion or edemas present. Is that okay, sir? Okay, sir, can you hold your hand? If there is masses, okay. Next, I will palpate the upper extremities for the lesion, rashes, and masses present in his shoulder. Another hand, sir. Okay. As I inspect and palpate the upper extremities of the patient, there is no presence of lesion, rashes, and masses on his upper extremities. I'll ask the patient to extend his arm and rapidly turn into up and down motion.
Check.
Okay, sir, can you extend your arm? And move your palm into upside and down. Okay, very good, sir. I will let the patient move his upper arm and then resist my opposing force. Can you extend your upper arm like this? One side na po. Okay? And please resist my opposing partners. Okay, sir? Wait muna, sir. Okay, sir. On arm. Go. Okay, very good. The other hand, sir. Again. Okay, very good. Next, I will inspect and palpate the hands, fingers, wrists, and elbow joints of the patient. Okay, sir, can I have your hand and I will palpate it, sir? And your fingers, sir? And I will inspect muna, sir. Okay? On the other hand, sir. The wrist. Fingers. Okay? And the elbow joint. And I will inspect. Okay? Next, I will palpate the radial and bronchial pulses of the patient. Yes, sir? We'll palpate the radial and bronchial of yours. This is the radial. Okay? And bronchial. Okay? Thank you, sir. Next, have the patient squeeze two of your fingers. Okay, sir? Can you squeeze my two fingers? Okay? Another, sir? Okay? Next, I will let the patient close his eyes and then I will put some object like key and let him identify it. Sir, I will let you close your eyes, then open your palm, and I will put some object and please identify it correctly. Is it okay, sir? Okay. Please close your eyes, sir, and please place your palm here. Okay. Identify it, sir.
One peso.
Okay, very good, sir. Another.
The medicine tablet.
Okay, very good, sir. Next, I will assist the patient to be on a supine position, and then I will inspect his leg and foot for the color and if there is a sign of varicosity, edema, rashes, and other abnormalities. Sir, I will let you be in a supine position. I will assist you, sir, now. Okay, sir. Next, I will inspect the legs and the feet of the patient. First, the color. Okay. Next, for the hair growth. As I observed, his hair growth was curly, and it was okay. I will inspect also if there is present for edema, rashes. Okay. And also, I will check if there is a present for varicosities. And lastly, the nails. As I check the legs and the feet of the patient, his nail growth was healthy, and as well as the hair growth, there is no presence of varicosities, edema, and rashes. Next, I will test for pitting edema in the pretibial area by pressing fingers into the skin of pretibial area. As I press the pretibial area, there is no sign of edema. Palpate for pulse and skin temperature of the posterior tibial, dorsalis pedis, and also the popliteal area. Next, I will assist the patient to be on a sitting position to assist the dorsalis pedis, the popliteal area, and the posterior tibial. Sir, I will assist you to be in a sitting position, sir. Okay. Okay, sir. First, I will palpate the posterior tibial of yours, sir. Okay, that's your tibial. Okay. The popliteal area. And for the next leg, sir, the posterior tibial. Okay. The dorsalis pedis. And the popliteal area. Okay, thank you, sir. Next, I will have the patient perform a straight leg test in one leg at a time. Okay, sir. We will perform a straight leg test and one leg at a time, sir. Okay, sir. Up. Again. Okay. So, sir, can you do that without my assistance, sir? Please? Here, sir. Okay. Then the other leg, sir. Okay. Very good. Next, I will ask the patient to move one leg laterally with the knee into a straight to test abduction, and medially to test adduction of the hips. Okay, sir, for the abduction, can you put your feet here? Straight lang po. Okay. And the other, sir. Can you touch your feet here? Okay. And we will do the adduction, sir. Please raise your leg. And up, sir. Up po. Then, adduct. And the other hand, sir. The other leg, okay po, adduct. Okay, very good. Next, I will ask the patient to raise his thigh against the resistance of the hands. Next, have the patient push outwards against the resistance of your hands. Then, have the patient pull backward against the resistance of your hand. And then, repeat the opposite side. Okay, sir? Can you push outwards as I lift your thigh po? Okay. Can you resist it, sir? Okay. Again. Okay, very good. The next session, I will assess the patient's tendon reflex.
Take.
First, I will place my fingers above the patient's wrist and tap with a reflex hammer and repeat to the other arm. Okay, sir? Can I have your hands and your wrist? Okay. Katsa.
Take.
And the other hand, sir? Okay. Very good.
Take.
Next, I will place my fingers over the antecubital area and tap it with a reflex hammer and repeat on the other side of the hand. Nakalong na na. Nakalong na na. Kani? Klaro?
Klaro lagi.
Okay.
Inventory mo na bahala ka.
Okay, very good, sir. Another hand. Okay.
Place your finger over with a tricep tendon area and tap with a reflex hammer and repeat on the other side.
Okay, very good. Opo.
Take.
Next, I will tap the patella with a reflex hammer and repeat on the other side of the leg. Okay, sir. Okay, very good. The other side. Okay. I will tap over the Achilles tendon area with a reflex hammer and repeat on the other side of the Achilles tendon. Okay. Okay, very good. The other side, sir. Okay. Okay, very good. Next, I will stroke the sole of the patient's foot with the end of my reflex hammer. Okay, sir, I will touch your sole. And another side po. Okay. After that, I will ask the patient to dorsiflex and then plantar flex both feet against the opposing resistance. Okay, sir, we will perform dorsiflex. You will move your end of your toes here. And for the plantar flex, you will on the opposite side, like ganun po. Okay po? Okay. Okay po, sir. Dorsiflex. Okay po. Okay. And you're done. On the other side. Po. Okay. And the next step po is plantar flex po. Like opposing po. Okay. Okay. On the other side. Plantar flex po. Okay po. We will join both plantar dorsiflex and plantar flex po. Okay? Yan, sir. Dorsiflex. Okay? Plantar flex. Okay, very good. The other side po. Dorsiflex. Okay? Plantar flex po. Okay, very good po, sir. Needed, I will assist the patient to a standing position and observe the patient's his walks with a regular gait and the toes on the heels and then bend the heel to toe. I will assist you to walk the heel and to toe and the toe to heel. Okay po. Mo ba ito tama ang mo? Go. Wait up!
May isa. Okay. Take.
Ha?
Uy, take niya.
Ha?
Go na!
Oh.
Mm-hmm.
Okay, back then, sir.
Cut. Okay na?
Tapos ka
Ana, tindog. Okay, take.
We'll use the knee. Okay. The other side po. Okay. Very good po.
Okay, 5 stars.
Next, I will perform the Rumberg test to the patient. I will ask the patient to stand straight with the feet together. Then both eyes are closed with the arms at side. I will wait for 20 minutes and observe for the patient swaying and ability to maintain balance. And I must be alert to prevent fall or injury related losing balance during this assessment. Okay, sir, I will assist you in the Rumberg test. You will do like this and your arms like that. Po. And you will close your eyes. Then I will be assisting you if you fall to avoid injury. Okay, po. Close your eyes. You have to just Okay, sir, open your eyes and put your hands at the back. And after that, I will let the patient to be on a comfortable position. Okay, sir, can you sit there? Then, perform hand hygiene. And lastly, I will be documenting the findings of the assessment. Okay, sir. All the documents that I've gathered will be referred to the attending physician. Thank you for your cooperation, sir. Have a good day.